It's 12:16. Hello, everybody. Welcome back. It's actually been a pretty good week as far as COVID numbers. Things are heading in the right direction. Again, the arguments, the discussion is starting to increase more and more about what is herd immunity, is the rate of decline, which seems relatively precipitous with how high we got. So a lot of folks are arguing that that must mean that we're kind of entering into some form of herd immunity. Again, I know we talked about this a little bit last week. It's kind of a difficult thing to get at. The numbers, the earlier in the pandemic, folks were saying if we got 30 to 40% exposed and or vaccinated, we could reach herd immunity. The worst, highest end of the number gets up to about 80%. So we are not really even to 30% at this point. But we obviously don't know everyone who is infected either, because so much of it is asymptomatic. And it is interesting that we haven't seen a huge stronghold of the variants at this point. Although there was an interesting article yesterday about California, as you may have heard, has its own variant. And it appears that the California variant has actually been fairly prevalent in the population in California for a while when they went back and retrospectively tested. So it may be that these variants have been present for longer than we thought, and therefore the concern about the increase in spread and the additional surge may not be as ungodly as we thought it could possibly be if these variants took hold. But still, with the surveillance that's happening, it still appears that the variants are relatively low, and I don't know that we've caught any variants here locally. I haven't heard that reported in a bit, but at least it was a week ago. It seemed like there was none, if I remember correctly. So that's where we stand for now. We can look at the numbers. The worst of all the numbers is that we have now eclipsed the 500,000 mortality mark. So that's, certainly once you get to 1 in every 720 Americans roughly have now died because of the pandemic. That's a pretty egregious number. And unfortunately, it continues to climb. There's a bit of discrepancy. This site that I use that reports the numbers always seems to be potentially a little bit ahead of what commonly gets reported on the news. I do think some of that had to do with this site does incorporate, if you remember, the suspected COVID mortalities in the early days of the pandemic. So it may be that this is closer to accurate, but potentially a little bit more than what's getting reported day to day on the local news. You can see the number of cases daily kind of bumps around a little bit. Even locally, we kind of got down to about 100. We've gone back up to the 110 kind of range. Nationally, you can see the same thing, got down to 63,000, back up to 71. So it's kind of bumping around, but as you look at the trend of percent positives over time, we are definitely on a steady downward course at this point. And even better, I think locally we are now at something like 43% of hospital beds available. And if you look at COVID capacity, it's even less. So that's really good. We're certainly seeing hospitalizations fall. With that, we're finally seeing ICU occupancy falling. So that's certainly unloading the hospitals. This has led to a huge amount of discussion of, does this mean that we can be a bit more relaxed, open things up more aggressively? You probably heard already in New York State, there's large concert and sports venues have been cleared to open at reduced capacity. So we're definitely going to see some return to normalcy, whatever that will be. But probably, I think all the current estimates are that true return to normalcy will likely be towards the end of the year at soonest. Even though, I think everyone's starting to argue that normal will never be the normal that we knew before. But other than that, I think the numbers are heading in the right direction. The vaccination availability is starting to head in the right direction, although clearly not catching up to the demand, which is good. We want to have people wanting to get vaccinated. Obviously, we'd like to be able to vaccinate those people more aggressively. We can look at the graphics. It's doing exactly what you would think based on just looking at the numbers tabularly. So you can see we've definitely crested as far as the number of positive cases. It even looks like we're there as far as mortality, which is great. You can see the percent positive in Monroe County. It's much more apparent, where we had gone down to a very low percent positive, then peaked over the holiday months, and now we're heading back down to where we were before, which is great. Hospitalization, you can see that curve has fallen precipitously. ICU is certainly down. Mortality is starting to crest, and if you follow the curve, we should say within this next week that we should crest in the local mortality, which is good. If we look at regional, so new diagnosis, this one bumps around a lot. It's kind of a Richter scale, but definitely on the way down for sure. If we look at the regional data that comes from Nick Apostolaris and company, basically the whole region's heading in the same direction. And this is also true for mortalities, as he reports out. If you look at that in isolation, that mortality rate is also steadily heading downwards in all, but I think Chemung County may have had a slight bump up, but the rest of them were heading down across the board, which is terrific. And we are seeing finally all of the local affiliate hospitals are really seeing a downward trend in cases now, which is good. So that's going very well. As far as the vaccine, good news just within the last couple of hours. So the FDA, remember the FDA emergency use authorization goes through several cycles. So the FDA Scientific Review Board has now come out with a statement that the Johnson & Johnson vaccine is safe and effective. That should allow for the move to approval, which probably means if it follows the historical of what would be available within the next 2 weeks, maybe as short as 7 days. And they continue to say that they have vaccine ready to ship up to about 100 million doses, although it may be April or so before they get to that full 100 million dose shipped contingency. But again, the benefit of this one is it's the 1-dose vaccine. Again, the absolute efficacy or achieving neutralizing antibodies does seem to be lower than what it was for Pfizer and Moderna. However, the prevention of serious disease, hospitalization, and death is in that 90, I think it's 88% threshold, which is still very good for any vaccine. And it does appear that it is effective, as far as we know so far, against most of the variants it has been tested against. There has been some back and forth about Moderna and Pfizer about whether it was effective against the variants. So I think it was last Monday that they came out with a fairly strong statement from both Moderna and Pfizer that said it was in fact, although it did not achieve the same level of neutralizing antibodies, it still did have the same efficacy at preventing severe disease. There was a report, I think it came from someone within the CDC, that there was a concern about lack of efficacy against the South African variant. That seems to now be refuted as best I can tell. But nonetheless, fortunately, the predominance had been mainly UK variant within the US. We had seen some South African variant, but not as much, thankfully, thus far. I think it was only 8 states that had reported cases of the South African variant, if I can recall. So it is very likely that we're continuing to see increase of vaccine coming to the region. It is unfortunately not coming to hospitals or healthcare providers. So it is going to the state pods, the Department of Health, the community pharmacies, and then just today, New York State opened a FEMA vaccination site, which is really aimed at more of the inner city zip codes. So it's cleared for vaccination of 65 and older that live within a certain area of zip codes, and they have thousands of appointments available as advertised for vaccination. So we'll include that information in the email that goes out today. But if you have patients that live in those zip codes, it sounds like they should be able to get an appointment for vaccine handily at this moment. So with that FEMA vaccine site, it may become an interesting discussion of geographic distribution of where folks go for vaccine. Obviously, the goal is to try to reach out to those in underserved and make sure that there's equity in vaccine distribution. So it is not to say that if you live in 14609, for example, which is one of the zip codes that's included in the FEMA site, that those folks would not be welcome at the Dome Arena site. And I don't think there's enough coordination at this point to say 14609 will go to FEMA. If you're 14 at this point, pretty much anybody can go anywhere where they can get an appointment. But the FEMA site will only allow folks. So right now, I think the total increase that we've seen in the last month, that's exactly right, over 16-year-olds with a pre-existing condition. That is correct. So in the last month, roughly since the beginning of January, we've seen a net increase of about 20 to 25% of vaccines. We had a flurry right before the holidays. Then we kind of saw a big drop off, and now we're seeing a net growth in vaccine, but it's still not being sent to hospitals and primary care practices. There has been an ongoing push and lobbying effort to get vaccine to primary care practices in particular. I know that it gets discussed quite frequently during the task force discussion and in multiple other venues, but I do not think there's no indication at this point that that's coming in the immediate future. That being said, as we start to move closer to spring, there is some discussion that by May, June, we may see some significant relaxation or removal altogether of anybody above the age of 16 could potentially be open for vaccination. So with that, we may see kind of open season of, anybody in that age group can now come in, schedule an appointment. And, the hope is that by late summer, most who want to be vaccinated will be and can be. So we'll see how that goes. Obviously, with the Moderna and Pfizer extra 100 million doses apiece scheduled to come out by around about June, that would suggest that by July, most people should be able to at least have an appointment, if not have access to the vaccine at that point. For our local region, it's a bit concerning if you look from Lake Ontario south. Monroe County, I think it's about 13%. They're vaccinated. I think Ontario County is about 15% of the population that's gotten their first dose. By the time you get down to Steuben and Allegheny, Steuben, I think, is at 9%. Allegheny is at 7.3% or thereabouts. And we see that kind of steady. It hovers above 10 throughout Livingston. I think even Genesee County, Wyoming County, I think, is hovering about 11. But down towards the Pennsylvania border, it definitely seems to be less. And it does appear in discussions with the Finger Lakes Task Force that there is more hesitance to pursuing vaccination the closer we get towards the Pennsylvania border. So there's already a lot of effort going on with setting up speakers bureaus, trying to reach out to the population through media to encourage people to pursue vaccination. We'll see what effect that has. But ultimately, I would not be surprised as the state starts to look at where they deploy these FEMA vaccination sites with a focus on equity, that we see more effort trying to reach out to the rural and extreme southern tier region, since that seems to be a paucity of vaccination thus far. So to date for the Finger Lakes region in total, so this is from the state's website, this is as of 11 o'clock this morning, there are 135,000 people who have gotten their first dose. That reflects 92% of all first doses that have been received that have been administered. So at 135,000, the estimate was we had about 1.7 million folks who would potentially need vaccination. So we're still, roughly 1 in 10 or so. We know that probably only 70–80% at best are going to be willing to receive vaccination. So realistically, we're probably at more of a 1 in 7 that want the vaccine, that have gotten it thus far. So not horrible, but still a far cry from where we want and need to be. So more to come on that. Otherwise, I think the vaccine information really hasn't changed dramatically. I do think there was some data from the UK about the one of the vaccines, the Oxford vaccine, that has shown some efficacy from the UK data as well. So whether we'll see that migrate our direction. There's also already some rapid trials ongoing about a nasal administered vaccine. Uh, Obviously, we'll hear more about that. Any report yet that the age range of, I think it's 12 and over for vaccine could be as early as within by May. So we may see expansion of that age range even a little bit more, getting down into the younger adolescent category. Young children probably, at least before, they were quoting fall before we would see that. I think that's all I got there. As far as other information, and we'll have this in the email today, there has been a change for healthcare workers about return to work after exposure. So if you are exposed, meaning more than 15 minutes, less than 6 feet, one or both not masked, then that would be considered a significant COVID exposure. Even if you are asymptomatic, you have to be tested before you can return to work. So that is a change, whereas before, healthcare workers were allowed to return to work as long as they were asymptomatic, but now they must be tested if they've been considered to have a significant COVID exposure before they can return to work. So we'll have that information today. There has been some conversation, and I actually checked with Renee because I missed the command center meeting yesterday. There has been some conversation about whether healthcare workers who have been vaccinated potentially not having to do any type of isolation or testing. That has not been formally approved as of yet, but that may be coming in the near future because that's been discussed quite a bit as of late. So more to come on that one. I think that runs the most of my list. The PPE distribution, that was largely my fault that we didn't get to do that this week. So we need to be able to receive this large bolus of goodies, but we needed a room to put the large bolus of goodies. Otherwise, we would not be sitting at our desk. We'd be sitting on boxes of N95s and gloves. So we now have a space within the building that we can receive the goodies. The supply chain folks will be delivering those to us, and by next week, we should have those ready to deliver out to all of you. So find your staff member, family, friend that has the biggest possible car whatsoever, and then we will be loading them up with boxes of toys to bring to all of you. So that'll be next Wednesday as per always. LJ, do you want to talk about this return to school thing in particular, or anything else for that matter?
No, I don't want to talk about return to school.
Okay.
I'm only joking. No, I'm only joking. And I did have a couple. I can if someone wants me to. I had a couple of updates, just the qualifications that I wanted to make around the vaccines first for 16 and 17-year-olds and up. And I appreciate that Karen Pennard put in the chat, and then Chad qualified that those kids who have chronic health conditions that qualify for vaccine are eligible. It's really important to note that the 16 and 17-year-olds should be referred to a Pfizer site. Moderna is only allowed for 18 and up. And so it would be the Hawkeye site and the Dome site would be the two where they would be eligible. I wanted to let you know, I've been working with Tim Stevens at Golisano Children's, and they will be sending out notices, emails or through my chart for patients who come to Golisano Children's Peds for specialty care. They will be receiving, what information we have. This is so tricky because it's not like we can call the patients in to immunize them, but that's the way that this goes. But at least convey the information so they know that they would qualify and that where they could go. So you all will be receiving an email coming from Tim's office, probably just a little later. Maybe he already went out. I haven't been on my email recently, summarizing that. I think that the other thing is for if you're giving this information to your patients, make sure they know for a 16 or a 17-year-old, we anticipate parental consent is required. We've been trying to find that out, but since it's required for other things, they should not show up at a site without someone, a parent or guardian, who can give that consent, at least as of the moment. If that changes, we'll let you know. And then there were just two other things in the pediatric care end that again will be summarized in this message that's coming out from Tim, but just wanted to highlight here. One is that monoclonal antibody therapy, so Regeneron, is available at Gulf Children's Hospital for patients who with complex medical conditions who qualify, who've been diagnosed with COVID-19. They are for patients who have comorbidities who are greater than or equal to 12 years of age and greater than or equal to 40 kilograms. This will all come out to you in this message, but just wanted to make sure that our pediatric providers were aware of that. You do have a patient who tests positive for COVID-19 and has one of these comorbid conditions. And then the last thing is just a quick update on MIS-C, so multi-system inflammatory syndrome in children. As you all know, for those of you who were on the call back in January, we had Regina Rao, the pediatric infectious disease specialist, joining us, who was saying they were starting to see an uptick in cases again. So at that point, she was talking about there having been approximately, sounded like a few, 3 back earlier in the pandemic, seen at GCH, and then again, they were starting to see an increase, a few, but actually now I just got the update. There was quite a few that came through in the last few weeks. So it's been 19 children or adolescents who've been diagnosed with MIS-C. In talking with the inpatient teams, it's a broad presentation. You know, some of these kids are very sick and end up in the PICU. Many of them have just required attention in the hospital setting, but not ICU level care. And so since there's that lag time before MIS-C develops, it's really important that we just continue to be mindful of that. So even though our rates are dropping in terms of acute infection, they're still seeing cases. And we'll get more data for you. I've asked for them to drill down a little bit about age ranges, you know, other things. And the inpatient team, collaborative team that's worked on the outpatient MIS-C guidelines is meeting right now. And we are anticipating there may be some slight revisions. So Renee, I'm trying to get that to you today to put out, and we'll just highlight what those revisions are. I just don't know what they are because they're meeting right now to determine that. And I think there was something in the chat. So Janet, we're going to put, I don't feel like I can speak specifically to exactly who can get the monoclonal antibodies. There's a listing of diagnoses or things that would put patients at greater risk for complications from COVID. And at what point in their illness, I think the idea is to do it sooner than later in that space. So I'll ask for a couple qualifying pieces. There's a nice attachment that'll come out with the email that we can actually, Renee, if you don't mind, we'll share that on our stuff today too, that just gives more information about monoclonal antibody in pediatric patients.
All right. Renee, anything you got?
Oh, how nice. I didn't even know that.
As
Happy
I said this
birthday,
morning,
Chad.
How could you not know all the parades coming by, the adoring fans cheering at the window?
Chad, why don't you show everyone what you wanted for your birthday?
I can.
You wanted an Elmo balloon.
And I have it, so there you go.
Exactly, Elizabeth, exactly.
25 years young. It's a beautiful day.
Me too.
That's right, Mark Cronin's birthday was yesterday.
Yep.
Mark, are you here?
Age before beauty.
No, Mark?
And Katie too, right?
Oh,
Katie
well.
Deal?
Yeah,
Oh, that's
Katie
right.
Deal.
Katie Deal, that's
Yeah.
right.
Yeah.
I'm laughing at this chat. It's just awesome. All those good wishes. So nice.
So I think, Renee, did you have anything else that you wanted to cover?
I don't think that can be topped. So no, not a thing. We're glad you
Once
were.
you go Elmo balloon,
We're glad you were born, Chad.
That's right. I am too, actually. Big fan.
Oh, God.
All right, guys, we will finish early then today. So thank everyone. And we will see you next Wednesday for the PPE pickup in the morning. And then we'll be back here at 12:15 as always. So thank you all.
Great.
And have a lovely rest of your week. Take care.
Bye.